The respiratory system has three major parts: the airway, the lungs, and the muscles of respiration. The airway includes the mouth, trachea, larynx, bronchi, and bronchioles, which carry air between the lungs and the body's exterior. Additionally, gases are exchanged as oxygen flows into the body and carbon dioxide flows out. Now, the muscles of respiration include the diaphragm and the intercostal muscles, which work together to act as a pump, pushing air into and out of the lungs during breathing. At the base of our lungs is a membrane called the diaphragm. Now, the diaphragm contracts and flattens out during inhalation to increase the volume and decrease the pressure in your chest. In this project, the lungs are like the balloon, and the diaphragm is like the balloon membranes at the base of this bottle. When you exhale, your diaphragm relaxes, which decreases the volume of your lungs and increases the pressure in your chest. As pressure builds, the air gets forced back out through your mouth and your nose. Now, once again, you can see here where I'm pulling down on the base, which would be the diaphragm. And as I pull down, it creates pressure, which pulls in more air into the straws, which represent the bronchi, and fills up the balloon. So during inhalation, the diaphragm contracts downward, the rib muscles pull out upward, causing air to fill the lungs. The increased volume of the thoracic cavity and the decreased pressure in the lungs allows the air to flow from the higher pressure environment to the lower pressure area into the lungs. And in this scene, I am pushing up on the bottom of the base, which would be the diaphragm, and that is decreasing the pressure on the inner cavity, which allows the air to be exhaled and the lungs deflate. So during exhalation, the diaphragm relaxes, the lungs contract, which causes the air to be pushed out of the lungs. The decreased volume of the thoracic cavity and the increased pressure in the lungs, the air will flow from the higher pressure environment to the lower pressure area outside of the lungs. So there's several different things that can cause people to have different lung capacity volumes. For here, you can see that we are looking at a healthy lung on the left side, and on the right side is a lung that has COPD. So total lung capacity, normal maximum inhalation of volume of air in the lungs would be 6 liters in a normal adult male. So people who live in high altitudes tend to have larger capacities to compensate for the lower atmospheric pressure. So they would have a higher capacity. And then they also have found that high altitude natives exhibit large lung volumes and greater efficiency of oxygen transport to tissues, both at rest and during exercise. So another thing that can affect lung capacity and actually decrease it is lifestyle. So obese people and smokers tend to have lower capacity and higher rates of ventilation. So like COPD, the airways in your lungs become inflamed, thicken, and the tissue where the oxygen is exchanged, the little alveoli, is destroyed. So the flow in and out of the air out of your lungs decreases. When that happens, less oxygenation occurs in the body. It becomes harder to get rid of waste gas like carbon dioxide. People with COPD actually thrive on the CO2 instead of the oxygen. And then as the disease gets worse, shortness of breath makes it harder to remain active. In this picture here, you can get a good idea of the difference between the asthmatic lung and a normal lung. In the alveoli and the bronchioles and bronchi, if you can see, there's a lot of inflammation that occurs, excess secretions. So the airways are much tighter, more constricted. It gets harder for people to breathe. Asthma is actually classified as a chronic inflammatory disease of the airways. The airways are caused by allergens and other triggers can be hyper-responsive, have mucosal edema, excess mucus production, inflammation, and it ultimately leads to recurrent episodes of asthma symptoms. The people with asthma may experience symptoms where they are having difficulty for like minutes and hours, or there may be days where they have no symptoms whatsoever. They could be coughing. There's just a lot of different uh, levels of it, but if it left untreated, it can actually continue to damage the lungs and lead to COPD. So it's really important that you get it under control. And then also, if it's not controlled, it could actually lead to death. So it's very important that asthma be managed properly. One of the main jobs as nurses is patient education. And when you educate patients and their caregivers regarding asthma, it's important that you begin with the basics of the pathophysiology, how the airways are constricted, how they fill with the mucus, staying hydrated to thin those mucus out, to make sure that they are using their medications properly. There's actually maintenance medications to prevent. It keeps the airways open, inflammation down, and then during times of exasperation, then need to use their rescue inhaler. Now, also knowing how to use those inhalers correctly is very important. Some of the medications can cause candidiasis in the mouth, so it's important to teach them to rinse their mouths after using them, how to use spacers if necessary. And then one of the big things is teaching them how to avoid triggers. What are their triggers? And then you want to teach them how to use peak flow meters, and that's going to teach them how well controlled their asthma is. There's different levels of control. We'll go into that more in detail in the next slide. But another thing is pursed lip breathing can help when they're having an attack. And then early recognition of infections is very important, because infections, if they get in there and like clog up those lungs, and you've already got that inflammation going, they can go into a severe asthma attack very quickly. Staying up to date on their vaccinations. Every year they should get an influenza vaccine and a pneumonia vaccine. And now that we're into the COVID, it's very important that they be vaccinated against COVID as well. They also should have their own individualized asthma plan with their healthcare team, because everyone's asthma is different, their triggers are different. So they need to know when to contact their healthcare team with questions, concerns, or when to seek urgent treatment. So last of all, knowing the best peak flow numbers that are individualized to the person is one of the best ways to manage the asthma. This is done by completing a peak flow test twice a day for a couple of weeks, and then also as directed by the provider. You'll also want to do it after using your rescue inhaler to see how quickly you recover. And then after you have a log of your peak flow measurements, you will take it to your healthcare provider. They will put it into like a stoplight system with a green zone, yellow zone, and red zone. Now, the green zone is your personal best. You're feeling good, you have no symptoms, you're going about your day like normal. You get to your yellow zone, and this is when you're having some symptoms. You may be waking up a couple of times during the night, having to use the inhaler. You could be coughing, wheezing, just a little bit of difficulty with your normal day activities. If you stay in that zone for more than 24 hours, you need to contact your doctor. And then if you get to the red zone, you're having trouble breathing, you're coughing, you're wheezing, you're having trouble talking and walking, you're not responding to your inhalers, you need to contact 911 and let your doctor know. Thank you so much for listening to my presentation.